Hey, good evening. It's your old pal, Dr. Steve from Weird Medicine, doing a little live stream tonight. Old Tacy's in Mexico. Espero que ella practica su español, pero no creo. No lo creo. Anyway, I'm just hanging out. We're trying some new stuff. We found that we are part of the YouTube Partner Program. So if you're watching this, you can actually join the channel. It's like 99 cents. That was the lowest that they would let us do. You know I always undervalue my work. And for 99 cents, you get some weird stickers when you do the chat. Who cares? And we could do a members only thing if we get enough people, or we could just do a Q&A with just members only. Good evening, king of all diffs. There are many diffs in this world. There's Cardiff, who is a potato. Corndiff is an ear of corn. Cordiff has an interesting origin story, basically created by one Greg Opie Hughes when he understood Cardiff wrong and said it wrong, and then Cordiff was born, and he is an actual potato. And then there's C. diff, which is voluminous watery diarrhea, aka pseudomembranous colitis. And then king of all diffs. So you are the king of all of those diffs, including C. diff, my friend. So it's a dubious distinction. Anyway, tonight, I really want to talk to you about an article that I read, and it's not the worst case of medical journalism that I've ever seen. You know, I have issues with medical journalism. I'm starting to realize it isn't so much the people writing the articles, but it's the editors writing the headlines that are the problem. Hello, Game Junkie. And here's one. Why non-melanoma skin cancer is now more deadly than melanoma worldwide. Let me get rid of my weird medicine thing there real quick. How can I get rid of that? I don't know. Okay, don't know how to get rid of it. Because it now, oh, there we go. Thank you. Why non-melanoma skin cancer is now more deadly than melanoma worldwide. So something must have happened, right? Something terrible is going on with the world. Probably has something to do with global warming. Because why else would non-melanoma skin cancer be now more deadly than melanoma worldwide? Well, you know why? Because there's more of it. Okay, there is the link to the article. You feel free to look at it yourself. But is this really news? I mean, non-melanoma skin cancers accounted for more deaths worldwide than melanoma because they're more common. Growing aging population could be one reason. Non-melanoma skin cancer is treatable, in most cases preventable, but it does kill people, and we're going to talk about that. So this study presented at the European Academy of Dermatology and Neurology reports there are now more global deaths from non-melanoma skin cancer than melanoma itself. Now, non-melanoma skin cancers are less deadly than melanomas, but their prevalence, in other words, the percentage of cases in the population is so high, the number of deaths is higher. Well, it makes sense. You think about, well, I've got an example coming up that will illustrate this pretty well. Let's talk a little bit about incidence versus prevalence. So incidence is is usually expressed as a percentage, but it's number of new cases in a population. So if you have a population of 1,000 and there's 100 cases, well, it would be 100 per 1,000 or 10 per 100 or 10%. And then the prevalence is how many actually have it in the community. So if you have that same community of 1,000 and they get 100 every year, but those people live 3 years, generally, and then they die off. So there would be a prevalence of 300 per 1,000, or 30 per 100, which would be 30%. Okay, so that's the difference between incidence and prevalence. All right, well, let's look at the next thing here. So I did some calculation. It says in 2020, there were 1.2 million cases of non-melanoma skin cancer worldwide, compared with 324,000 cases of melanoma. Now you can kind of dope this out. I actually did check their math on this, where they said non-melanoma skin cancers accounted for 78% of all skin cancer cases. So you would have to take 1.2 million, divide it by 0.78, and it should give you the total, which would be 1.2 million plus 324 million, and it actually was right. So I was pleasantly surprised to see that they had that. Okay, well, anyway, so non-melanoma skin cancers accounted for 63,700 deaths. Melanoma resulted in 57,000 deaths. So you could kind of already figure this out. If there's 1.2 million in one group and 324,000 in the other group, and the numbers are just about the same, it's going to be about 4 times more, something like that, right? 3 to 4 times more. And in fact, that's what we see. 63,700 deaths out of 1.2 million cases is a mortality rate of 5.3%. That's 5%. That's a lot for melanoma skin cancers. And then 57,000 deaths out of 324,000 cases of melanoma is 17.5%, 18%. So 5 versus 18%. And that still means the vast majority of people with melanoma don't die from it. So if you are ever diagnosed with it, not the death sentence you may have thought, particularly if you catch it early. We're going to talk about that. People ignore this stuff. How could somebody die from a basal cell skin cancer, you say? Well, we're going to talk about that in a little bit, but here's an analogy. Look at the number of deaths due to automobiles versus motorcycles. Even though riding a motorcycle is statistically more dangerous, there are more automobile deaths per year because so many more people drive cars than are riding motorcycles. So, the absolute number is higher. The relative numbers are much lower. Remember your relative risk and your absolute risk. So let's at least get something out of this, and then I'll take some questions from the chat if there are any on any topic. It doesn't have to just be this. So there are things called actinic keratoses. Actinic keratoses are rough scaly patches or bumps on the skin. They're also known as solar keratosis. These are common. Lots of people have them. Farmers, people who work outside will have them. And if you look over here on the left, you see this sort of scaly, bumpy things, and you can pick them off, but then they'll grow back. And then this thing next to it is called a keratotic horn. Now, actinic keratosis with a keratotic horn, that's just this actinic keratosis. Okay, actinic means because due to sun. Keratosis is sort of the plasticky substance that skin makes that protects it, makes nails and stuff. So a keratotic horn, kind of like a toenail. And this thing is just producing so much keratin that makes this horn. The problem is these things are precancerous, so you really can't ignore them. They're very treatable. Risk factors are fair skin, age greater than 65. We would treat these with cryotherapy. I used to use a chemical called bichloroacetic acid, which there's a trichloroacetic acid. When you open it up, it actually fumes. You can see the fumes. But bichloroacetic acid is just vinegar with an extra couple of chlorines attached to it. It makes it very, very reactive. and you can just put it on with a little like a toothpick or a swab, and it will most of the time kill these things. Also, if you have seborrheic keratoses, those are the sort of brown, flat, oily, greasy looking things. Some people call them age spots. Those respond really well to bichloroacetic acid. It'll leave a little bit of a scar in that the skin will be pink, but it's better than being goopy and brown. But anyway, all right. Now, I'm going to give you a trigger warning. The next bunch of pictures I'm going to show you is maybe be disturbing to some people. So I'm assuming YouTube will let me do this because it's these things are real medical problems that and you need to see them so that you can make sure that you don't ignore them going forward. But I'm just giving you fair warning. And if I have to blur them in post because of YouTube telling me so, I will. But this one's not so bad. This is squamous cell skin cancer. This is what those actinic keratoses will turn into. It's the second most common form of skin cancer, usually not life-threatening. If you catch it in this phase, you just cut it off and ablate the base, and you're done. But if you don't treat it, it will just grow and grow and grow and grow and grow. So I've seen cases where people just let it go and they wouldn't go to the doctor, they wouldn't go, and they didn't want anything done. And then the thing grows into their carotid artery, which is the artery in your neck. And when that happens, it becomes a terminal illness because it's going to eat into the carotid artery and will eventually cause it to rupture, and the patient will exsanguinate. And all of a sudden, they want everything done. It's like, well, we could have taken care of this when it was this big on your jaw, but now it's this big and it's covering there's nothing we can do. You can't fix that. So don't ignore these, please. These will be raised often with an ulcerated base. The surrounding tissue is not pearly. You'll see what I mean in a minute when I contrast this with a basal cell skin cancer. So one thing that you want to do, and I'm going to say this over and over again, and I haven't done this, so I will pledge to do it if you guys will, is go and get a dermatologist to do a skin survey, and you're supposed to do it once a year. We have this doctor here in my town, and he's notorious for looking at every nook and cranny on your body, and by every nook and cranny, yeah, use your imagination. I mean, this guy is all in it, and but he doesn't miss melanomas on people. So I have a melanotic lesion on the bottom of my foot that's been there forever, but it is not a melanoma, and I'll show you the difference here in a second. Okay, so here comes that trigger warning. Don't let these things go, right? It's totally treatable, 100% curable. Just listen to me. This will save someone's life. Don't ignore these, because when they get to be a certain size, and if they're in a certain place, there isn't anything you can do about it. Okay, so I'm just going to skip over that because it is disturbing. Now, here's a basal cell. Basal cell is the most common skin cancer. It starts in the cells down in the basal part of the layers of the skin, and they spread very slowly. They rarely will spread to other parts of the body, but it, again, will continue to grow and grow and grow, and I have seen one or two terminal cases of basal cell that were just let go until there was nothing you could do about it. It started to invade things that were a problem, making people not be able to eat or not speak or things like that. So listen, the 5-year survival rate, whoops, let me go back to that. 5-year survival rate is 100% if you treat it. So just get it treated. If you have something growing on your skin and it wasn't there before, get it looked at. Even if it's just a dumb skin tag, you can have it removed because those things look gross anyway. They're very easy to get rid of. Okay? So please don't ignore these. So pearly border, usually not ulcerated in the middle, but depressed in the middle, growing over time. That's a basal cell. Okay, so here's melanoma. I just want you to see this. A mole is not a melanoma. Look at how these things, it looks like a sunspot. If I took a picture of the sun and took a picture of one of the sunspots that we ham radio operators like to see because it improves propagation on some of the higher frequency bands, that's what it looks like. These things almost look like sunspots. And they're irregular, geographic bordered, usually, not always. And the color is variegated. Now look at this one. See, this looks almost like a mole, but then it's like it's fading, like somebody took a paintbrush and dabbed it here and then just faded it across here. That's very typical. So look for those. These are very serious. They again, the vast majority of people, if they're caught early, will survive. P.A. Jill was talked about on this show. She had melanoma twice, and she's fine, just walking around. It's stage 1, stage 2. Melanomas can be removed. They do a thing called Mohs surgery. Oh, a wise guy, Mo. And I'm so sorry. Hang on. I just got to give myself one of these. Anyway, they do this thing called Mohs surgery where they will take a layer and then look at it under frozen section. Immediately they'll flash freeze it, and they'll keep doing it until the layers are clear. And it's a really good way to just be done with the melanoma from the beginning, okay? Usually curable when detected and treated early, okay? So how do you prevent these things? Sunblock. Get a skin survey. That won't prevent you from getting one, but it'll prevent you from dying from one. And you know if you're at risk of something, you're less likely of dying from it. So if you've ever had a blistering sunburn, you are at risk for melanoma in that place. So just get a skin survey. You're less likely to die from it if you know you're at high risk, assuming that you do this screening, okay? And do your self-surveys. Look at your skin. Don't ignore stuff, okay? Take that from your old pal, Dr. Steve. All right. Okie dokie. That's all I've got on skin cancer. That really wasn't the worst article. It was just the title that just sort of implies there's something why non-melanoma skin cancer is now more deadly than melanoma worldwide. What's changed? What happened? What, scary kids, melanoma skin cancer is now more, it's just, get out of here with that. It's just, there's more old people. That's all it is, all right? So stop with the goofy headlines, but the actual article itself wasn't too bad, although I added all this stuff about all the different skin cancers. All right, let's look and see if anyone's got, I didn't send out a link. King of all dips, I didn't send a link out. I wasn't sure how this was going to go. I will next time. I'll just put one out so that you guys can just pop in. But you can ask questions here, and I'll help any way you can. Have you been following the Take Care of Maya trial? No. I don't know what that is. Let me look. Take Care of Maya comes right up. Testifies. Okay, $220 million case against some children's hospital. Let me see. A teen at the heart of a $220 million lawsuit against Johns Hopkins. Let me see if I can bring this up so you all can read with me. It's a little bit different for me to present. Let me share my screen. Okay, here it is. Let's try it. Okay. After an emotional afternoon of testimony from her father and brother, Maya Kowalski, the teen at the heart of the $220 million lawsuit against Johns Hopkins, is that the premise of the Netflix documentary Take Care of Maya took the witness stand again on Friday morning. She told the jurors while she still experiences physical pain. How about, on this, they're just assuming that we know what they're talking about. This is not a well-written article. Let let me see. Come on now. Maya told the jurors that her CRPS, okay, so she has complex regional pain syndrome, fluctuates. She was at 7 to 8 pain threshold as she sat on the witness stand. She has lesions and involuntary twitches. So what happened to her? Yeah, thanks for, okay, let me see here. Okay. They took Maya to Johns Hopkins in 2016 when she was experiencing a flare-up of pain from complex regional pain syndrome, or CRPS. This is used to be called reflex sympathetic dystrophy or causalgia. There's type 1 and type 2. I have complex regional pain syndrome myself from having a toenail removed, actually, and that wasn't fun. It was basically just due to trauma in the limb, causing what they think is changes in the neurologic system that feeds that limb, and it can cause mottling skin, it can cause thickening skin, it can cause pain, etc. She told her jurors that the condition would leave her screaming in pain, unable to walk. She received the painkiller ketamine during a series of intense treatments in Mexico, which she was told there's a 50% chance of death. What? Okay, she explained the ketamine treatment worked and she was improving until October flare-up. She insisted that she receive ketamine at Johns Hopkins, but the hospital disagreed with the treatments. It is not, at the time was not well known, and there are, regional differences. They do things differently in different countries. Doesn't make them right or wrong. Sometimes they're more advanced than we are, sometimes not as much. Her persistence alarmed the hospital staff. They called in a report to Child Abuse Hotline. They thought that she had Munchausen's. Okay, so Munchausen's by proxy is when the parent feigns illness in their child to get attention and to get them treated. And yeah, okay, and here it is right there, duh. Okay, so they thought this is horrible when this happens. When you get accused of something like this, when it's actually not true. There was a case of a kid that had osteogenesis imperfecta. And what osteogenesis imperfecta is a condition where kids have very brittle bones. And they will also have blue sclera on their eyes. The whites of their eyes will be blue. If you watched Vikings, that was what they hypothesized that what's his name, the Boneless, had, and that he actually had osteogenesis imperfecta, Ivar the Boneless. Anyway, and they'll take the kid into an emergency room, and the ER doctor will see all these broken bones and call the police saying that the kid is being abused, because why else would a kid have so many broken bones? And, that's a tough one. So, yeah, this looks like a mess. I'm assuming it spiraled from there. Let me tell you something. If you, and then they took the kid away from the family. Okay, goodness gracious. Yeah, what a nightmare. I feel really bad for that family. One of the things you got to do, if you go out of the country and get a treatment like that, you can't just show up in an emergency room demanding that. I mean, you should be able to. I agree. I mean, this is tragic. But it sounds like I'm blaming the parents. I'm not. Let me phrase that a different way. A functional way to take care of this would be to have an arrangement with a physical medicine and rehab person or a pain management specialist, so that when you get back to the States, hey, we got put on this ketamine stuff. It really works. And the sick thing is you can get ketamine mail order now. That's, just 8 years later. So not even that. When was that? 2016. So 7 years later, you can get ketamine mail order. How do I know? Because I'm on ketamine therapy from my physician. So, but let's just say you go to Switzerland and they have some goat gland thing that's really working for you, you need to have somebody in the United States that's willing to work with you on that. And then go to them, because if you show up in the emergency room, they are not equipped for out-of-the-box requests like that. So this was bad all the way around. Anyway, let's see here. What's the difference in appearance between actinic keratosis and scaly old age spots? Well, a lot of scaly old age spots are actinic keratoses. So the actinic keratoses will often be more localized, but you can tell it's not just dry skin. So many of those things actually are actinic keratoses. We just have been calling them scaly old age spots forever. Yeah, sorry, Scott. I'm sure that has to do with those pictures that I showed you. Yeah, this is about Maya. My heart goes out to that family and to that kid, and I hope she's getting treated now. That's the thing. But how traumatic? How traumatic is that for you to be taken away from your parents because they're seeking excellent medical care for you? Hang on just a second. Well, I just really can't podcast in October. Just my allergies kill me, and I even toked up on Breztri before I started this. All right, let's see here. Yeah, very sad case. I agree. Much more to the Maya case. Okay, well, I'll check that out, and then we will talk more about it. Then I'll watch the Netflix documentary. Tacey's coming home tomorrow, and she's been in Mexico for a week, so it serves her right if I make her watch something really depressing. So if there are no further questions in the chat room, thank you for letting me experiment with you tonight, and I will do more research on Maya, and thanks for bringing that up. And we'll see if we can go through the case point by point and see where the medical profession failed and how this maybe could have been prevented. Oh no, I didn't know that. Okay. Yeah, I can imagine. Listen, think of those parents who, it's supposed to be a fun show, but, not everything in medicine is fun. Think of the parents with the osteogenesis imperfecta kid. If that kid was taken away from them, that would be a little bit easier to prove. But it bothers me at Johns Hopkins, which is a very advanced institution, that nobody there went, oh yeah, they're doing ketamine for CRPS down in Mexico, and here's the data. So what we're going to do is, thanks to Not Cupcakes and Talk Like a Hick to You, a.k.a. Amy from Kentucky, we will do some research on this, and we're going to bring back exactly what happened and how this could have been prevented. I guess I said that already, but now I'm determined to do it. I'm really, really sorry that the mother felt the need to take her own life over this. And, the kid, and oh my God, what a nightmare. That's just one of the most horrendous stories I've heard, particularly of the medical profession not listening. Just fucking listen. I have a lot of patients that come to me and say, you're the only one, I'm not patting myself on the back, you're the only one that listens. Well, I have time. I have the time to do that in my practice. But it's like, why wouldn't you listen? If you tell me that only hydromorphone works for you, why would I put you on oxycodone? Even if it's complete horse shit, if I put you on something that you don't have confidence in, it won't work. There is a placebo effect. There's also a nocebo effect. If the patient doesn't believe that the treatment's going to work, it won't. So forcing that on you is ridiculous. And ketamine was not just a street drug in 2016. It was a dissociative anesthetic that still had clinical use. I mean, we've been using ketamine for vulvar cancer for years. You get a little tube of emollient, and put 5% ketamine, 5% lidocaine, and maybe a little gabapentin in there, and you've got someone that's got I mean, just imagine, remember those pictures that you saw of the squamous cell cancer? Imagine that on your genitalia. And that cream works very well. It will also work well made into a suppository for people, terminally ill patients that have rectal cancer, where the tumor is eating into the rectum. And I know normally you wouldn't want to put a suppository up there, but in these cases, it's the only thing that will offer them any relief is getting some topical ketamine in that area. So, I'm very bummed that this all went down and became some sort of disgusting cascade. And, the other thing is I'm really going to have to look into this because I don't understand how the patient advocate didn't get involved. Now, the patient advocate may have heard, oh, this mother is trying to do this and that, and then thought that they were advocating for the child. But you're supposed to advocate for, you have to sit down with everybody and hear all sides of the story. All somebody would have had to do was do that, it seems like. And hey, let us get you some records from this clinic in Mexico. This is the only thing that works for her. And just fucking listen. All of us could do better listening to each other, couldn't we? All right. Okay. Law and Lumber does 90 minutes a night. Okay. Well, I'm not going to do that. We'll do the highlights, but I do want to find where the medical profession fell down for this kid. But thank you, Not Cupcakes. I don't know. Do I know you by another name? Let me know. Just email me. All right. Well, sort of a horrifying show and then a bit of a bummer. But if this kind of thing can be prevented in the future by shedding a light on it, then there's nothing wrong with it. So I think that we're going to get to the bottom of this and talk about it some more. So anyway. All right. Well, thank you all. And I hope you have a wonderful night. And thanks for hanging out. Consider joining the channels, 99 cents. I'll figure out something to do just for members at some point. And you are who? Okay. How are you? All right. Stutter Child. And okay. Anyway, take care. Yeah. Hilarious. How do I do what I want to do here? Let me see here. I don't know that I can do it. Oh, yeah, I can. See ya.